Hello guys, and welcome back to today's video. I'm hoping you are doing well, and today's video is about diabetes. We are still handling diabetes. Today I want us to talk about one of the complications of diabetes, and that is diabetic foot. I will start by defining what is a diabetic foot. A diabetic foot is an ulceration. It's an ulceration of the foot due to advanced nerve dysfunction associated with high blood glucose levels. It's an ulceration of the foot due to advanced nerve dysfunction resulting from high blood glucose levels. And guys, once someone lives with diabetes for long, that is a poorly controlled diabetes, nerve dysfunction is also one of the complications of diabetes. So if your glucose levels are poorly controlled over time, you will develop nerve dysfunction, and so you find that these people, they have a reduced ability to sensitivity, mostly in their feet. So you find that because they have a reduced sensitivity, they are not able to sense when they have minor injuries to their feet. And so you find that one gets an injury, maybe a cut, and it goes undiscovered for a long time. And by the time they discover that they have a cut, these cuts may progress to full thickness, and that is what is termed as a diabetic foot. Have you understood, guys? It's an ulceration resulting from nerve dysfunction. You find that these patients who have poorly controlled diabetes over a long time, they develop nerve dysfunction. That is another complication. So once they develop nerve dysfunction, you find that these people, they are less sensitive, their feet. So you can find someone might have an injury at their feet, but they might not notice because their nerves are dysfunctional. So these injuries are the ones that develop over time, and they become a diabetic foot. So what are the most common sites of a diabetic foot? Number one, we have the plantar surface of the foot, and then number two, the toes. These are the two most common sites that are affected by these ulcers. So what are the causes? What are the causes of a diabetic foot? So you find number one cause of a diabetic foot is an injury. It's an injury that is caused to an area that is insensitive. It's not sensitive. So or it might have it might be vascularly compromised. That means the blood supply to the area is not sufficient, and hence this injury now develops, and it advances to become a diabetic foot. These patients, they don't notice, and so it might take long. And by the time someone notices he has an injury, it will have already developed to a diabetic foot. So what are the symptoms of a diabetic foot? Number one, you will notice that you have a leg ulcer that is draining. It is draining, and it has unusual smelling. Though some people who have a diabetic foot, that ulcer has a very bad odor, and then the place might have a dead tissue. That is what we call a gangrene, or it might have a black tissue called an eschar. Those are the symptoms. So if you have diabetes and you find out that you have a wound in your leg that is draining, it has a very bad odor, it has formed a black tissue, that might be a diabetes ulcer, and so you need to visit your doctor so that he can check and find out whether that is a diabetic foot. What are the risk factors? What are the risk factors to getting a diabetic foot? Number one, poor quality shoes. If I can remember, the last time I talked in the previous video, I said that if you know you have diabetes, you have to take good care of your feet. Ensure you wear your shoes always, because we have said that over time your nerves are destroyed. So you might develop an injury and you might not know. So a risk factor to getting an ulcer, a diabetic ulcer, is poor quality shoes. Poor quality shoes. Make sure that you wear shoes that covers your toes and your plantar surface, so that you cannot develop minor injuries. Number two is another risk factor is a poor hygiene. Make sure you have diabetes, make sure you wash your feet well. Make sure you wash your feet well and dry them. So two risk factors of diabetes, I will give you two. Number one is poor quality shoes, or people who don't wear shoes. Number two, poor hygiene to your feet. So if you know you are living with diabetes, make sure you always wear your shoes. So what is the treatment once someone has developed a diabetic foot? What is the treatment? So before we get to treatment, some of the ways you can ensure that you don't get a diabetes foot: make sure you wash your legs, your feet. Make sure every day when you are washing your feet, you examine. Make sure you examine your feet and make sure you don't have an injury. And then make sure you dry your legs. Wash your legs well and dry them. If you notice that you have a cut, make sure you wash your legs well and dry the area. And then immediately once you develop a cut on your feet, make sure you go to the hospital so that the cut or the wound gets to be dressed, washed. It has to be washed and cleaned. Once you develop a foot ulcer, make sure you visit the hospital so that your wound is cleaned and dressed. That is daily, or your doctor will advise you on how often to do it. Make sure the area is disinfected. Make sure you maintain hygiene. That is, once you have developed a foot ulcer, make sure you maintain hygiene. And so if you have developed that diabetic foot and it has become gangrenous, the treatment for that, your doctor might decide to remove the decaying tissue, or now once the tissue, the tissue has become gangrenous, the doctor might end up amputating either your toe or your knee, depending on what part has been affected. So that's why I encourage anybody who is living with diabetes to ensure that they have their feet on every time, unless you are sure either you are in the house and you are safe. Otherwise, if you are going outside, make sure you wear shoes that cover your feet well. So how can we prevent diabetic foot problems? Number one, if you have diabetes, number one, maintain hygiene. Make sure you wash your feet well and dry them. And when you are washing your feet, make sure you examine your feet to make sure that you don't have a cut. Number two, trim your toes. That goes under hygiene still. Keep your feet dry. Wash your feet and dry them. Another thing, wear proper fitting shoes. So that even if you walk, you are sure you can't be cut, or you can't get a cut. So yes, that is it with the diabetes foot. I have made it so brief, and so anybody who is living with diabetes, please, this is a takeaway home message. Number one, ensure you wear your shoes, ensure you wash your legs, ensure you examine your feet on a daily basis, and once you discover that you have a cut, make sure you visit the hospital immediately so that your wound can be cleaned and changed daily, on a daily basis, so that it can't develop to becoming gangrenous, so that you might not end up being amputated. So that is it for this video, guys. Thank you so much for coming back, and see you in the next video. Thank you.